Hi, everyone. We would like to welcome you on behalf of Dr. Pearlstein and Biltmore ENT Facial Plastics and Allergy to discuss what treatment options are available for obstructive sleep apnea. Before we get started, if you have any questions, at the bottom of your screen, there's a Q&A box. You can click on that and you can type in any questions that you may have. I will save those till the end. The questions are private and anonymous, so no one else will be able to see them except for me, Lauren. I work for Inspire Medical. I am a territory manager and I work with Dr. Pearlstein. So at the end, I'll read your questions and we'll make sure we get those answered for you. Dr. Pearlstein is a well-established otolaryngologist in the Valley. He works with Biltmore ENT. They have multiple practices and locations throughout the Valley for your convenience. Dr. Pearlstein sees both adult and pediatric patients and has special training and expertise in implanting the Inspire device. And he is from Cincinnati, Ohio. He has 2 young sons. He's an avid swimmer and just an all-around wonderful person. And I'm very excited to introduce him to you. So Dr. Pearlstein, I will let you take it over from here and talk to us about what treatment options are available for those of us who struggle with obstructive sleep apnea.
Great, thanks, Lauren. I really appreciate the introduction and working with Randy. And just a little clarification, I am from Ohio. I'm actually from Cleveland, Ohio, and I do not like the Cincinnati Bengals. I am a Cleveland Browns fan. Not much to root for lately, but anyway, that is my hometown, and
we'll forgive you for that.
Yes, and then hopefully one day we'll make it to the Mecca, but it's been 53 years, and we'll see. I'd like to give a little discussion about obstructive sleep apnea and the wonderful new treatments that are available, including the Inspire implants. And on our first slide, obstructive sleep apnea. What is sleep apnea? Well, there's people who are primary snorers, those who make a lot of noise, and it's not necessarily the patient that's complaining about it, but if you ask anybody's bed partner, whether they're still in the same bedroom or if they're in separate bedrooms, it really does change the dynamics, both of how they sleep, how they feel, etc., but also at times their marriages. But obstructive sleep apnea syndrome, generally it's people who are snoring, but they also stop breathing at night, and that's where the medical issues come in, and that's where the tongue and soft pouch during the sleep and block airflow. And this number that's quoted here, over 20 million Americans have moderate to severe sleep apnea. It's much higher than that. And we're probably getting into the 40 to 50 million range, particularly with the association of other comorbidities such as cardiac disorders, cardiac diseases, strokes, et cetera, which we'll get to in a little bit. What are the risk factors? Primarily, you see it in males, but that's not necessarily true anymore. And from the number of people that we've been doing implants, or at least I see on consultations, there are many women that have this problem. And I do hope that they do come in, even though it's a stigma to have the sleep apnea. It really, to do the treatments really does make a difference in their world. Age, it can be any age. And I have a couple of nephews who are 19 years old, 20 years old that are actually have sleep apneics that are on CPAP, anywhere to people all the way up to the spectrum, to the centennials, et cetera. Racial minorities, it can be a little bit higher in the people who are more obese, which can be a little bit in the minorities. Those are some of the things we're working out from a demographic standpoint. Cardiac abnormalities, metabolic hormonal abnormalities, those are big issues. And the amount of undiagnosed patients with cardiac disorders, atrial fibrillation, people who've had strokes, heart attacks, et cetera, is astronomically high. And we need to get those people plugged in at least and or treated. And then family history is very important. Consequences of untreated sleep apnea: fatigue, diminished productivity, and essentially I'm tired all day. That's what I hear. I'm not functional. I'm not the best person that I can be. Snoring, which we alluded to with your bed partner, is a big issue, and it does create marital problems. I have a sister who's a psychologist, and she's starting to see more and more people who have marital discord. Well, if she gets to the bottom line, it ends up being the sleep apnea or the snoring issues that are involved. Accident risks, which goes into car wrecks. I can't drive, I'm falling asleep. We see a number of people in the trucking industry that come in this, and they do need to be addressed. And then heart and brain health, which is incredibly important, which we'll get to in a little bit. Untreated sleep apnea, what are the issues that it can cause? Well, strokes, sudden cardiac death, cardiovascular mortality, atrial fibrillation and ablation. One of the biggest arms, what we're doing from an ENT clinical standpoint, particularly those of us who are actively involved in sleep apnea, we're trying to work collaboratively with the cardiology community to address many of these issues, and also the neurology community, because it's such a pervasive problem. That's one, it's undiagnosed, two, it's untreated, and three, we can help these people out significantly. Frontline treatments for sleep apnea, CPAP. And it's been around a long time. It's not for everybody, but it does work. It is still considered the gold standard. But as we go along, and we're going to get into the neural implants that we're going to discuss with the Inspire company, that is going to be the future of healthcare and the direction that we're going to be headed. Alternate treatment options, and something that's very important to me is when you have sleep apnea, snoring, sleep disordered breathing, there are many things that we can do that it's just not a one size fits all. And we really do need to address, at least from my clinical practice, this is addressing the patient as a whole person. And there are many things involved. We start with oral appliances. Can we do jaw thrusts and things like that to help? And there's a million companies out there that do these things. It's not one size fits all, and that's something that needs to be addressed from an individual standpoint. And something that's very big from an ENT standpoint is nasal anatomy. And we find that many people have sleep apnea or snoring issues related to altered nasal anatomy that do need to be addressed. We go into some of the old-fashioned treatments where I'm going to show my age, which is more of the palate surgeries, the tongue-based resections and things like that. We always reserve those for people who are not candidates for other alternative and or need co-managed with other treatments. How does Inspire work? It's a safe outpatient procedure, and it's as simple as putting, as we demonstrate on the right-hand side, a device on the chest, and we're going to have a little video demonstration on how this works. So he reaches over to the bedside, and a defibrillator-sized unit is implanted into the chest, and he turns it on. And you can see on the left-hand side where the airway closes, and what it does is sends a small stimulation impulse to a little cable wrapped around one of the nerves. It causes the tongue to go in the opposite direction or protrude to open up the airway when you're breathing, so it does not collapse to create the apneic issues. How is it done? It requires a general anesthetic. We do put people to sleep. It's done through 2 small incisions. It's a very quick recovery, typically over-the-counter meds for postoperative pain, return to non-strenuous activities within a few days. And if you wanted to go play golf, if you wanted to go climb a mountain here in Phoenix, that's generally 1 month. The half-life for the battery is 11.5 years. And MRIs can be formed safely of the head, neck, and extremities. The only area that is eliminated from, at least currently with the device as it exists today, is MRIs of the chest. MRIs of the chest are very uncommon. Most people get MRIs of extremities, which is not an issue, or their head for other reasons. And we have a small video, and on the left-hand side, you see where the base of tongue collapses and then where the palate collapses. That is creating the obstructive event. As we go over to the right-hand side with the stimulation of the impulse, it does not collapse, and you can still see on the base of tongue, you can see the larynx or the airway, and then the palate doesn't completely collapse. They're preventing both the snoring, or at least reducing the snoring significantly, but eliminating and or reducing significant events. After your Inspire procedure, the device is calibrated through both the Inspire company and their technology people and through a respiratory pulmonologist. They turn on the Inspire therapy about 30 days after the implant. The initial settings are set. It's comfortable, it's effective, and you learn how to use the Inspire sleep remote also at the first setting. Does it take more than 1 visit? It can. It can take 1 visit. Sometimes it can take up to 5 visits. This, and what I love about the company, is that everything is tailored specifically to you, the patient. This is not a one size fits all. And the device is only as good as their outcomes, and outcomes are incredibly important when we're doing this. So everything is individualized, and we will walk with you from the beginning to the end to make sure that you're calibrated appropriately. Indications for Inspire: moderate to severe obstructive sleep apnea, unable to get a consistent benefit from CPAP, or I can't wear the CPAP. I have claustrophobic issues. I have issues with the skin irritation, etc. Not significantly overweight, generally with a BMI less than 35. Pass an airway exam, called a drug-induced sleep endoscopy, over the age of 18, but we are putting implants in people less than 18 for certain diseases. And then it's covered by most insurances, approximately 85 national approval insurance rate. It is higher than that with commercial insurance. And the sustained clinical results, there have been many, many, many implants. I would imagine we're probably up to 40,000 worldwide at this point, and the outcomes are very favorable. There have been many publications, STAR trials, ADHERE registry, and the success rate is 93% for those who are properly selected to go through the process. And one person I'd like to introduce is Randy Livingston, who now has had implant for I think 2 to 3 years at this point. And Randy has gone from a respiratory index, an apnea hypopnea index of 28, and has gone down to 4. And it has made a world of difference in Randy's life. And I would love, Randy, for you to please discuss and talk to the people here about your outcomes in the process that you went through.
Yeah, thanks, Doc. I'm actually on year 4 of treatment, and it's been a great success for me. I got implanted on December 15th of 2017 and activated January 10th of 2018. The surgery was pretty easy, about 3 days of over-the-counter Advil at night, and the pain went away. And then you have to wait a month for activation. And activation day is a lot of fun. They ask you a series of questions to tailor the remote to your sleeping habits. And mine is set for a 30-minute delay. So I hit the bed, I hit the button, and I go to sleep. And after 30 minutes, the therapy starts. It works while you're sleeping. It doesn't interrupt your sleep. And you wake up like you would normally. It either has an auto shut off, or you can hit the off button and the therapy stops. It's really changed my life. It's brought my life back. I have a lot more energy. I used to have issues of falling asleep driving. I fell asleep once talking to my boss. I couldn't make it through the day without taking a couple naps. And I had some memory issues where I was having some short-term memory issues with, I couldn't remember a 5-digit odometer and walk it back inside where I worked. I had to write everything down, and that's all been reversed. A lot of questions I get asked is, what does the therapy feel like? Well, it nudges your tongue forward like 1/8 of an inch and opens your airway, and there's no pain involved. And the other big question I get is about airport security. There's no issues with airport security. You walk right through. They don't even know you have the device. If they were to ask you a question, you do have a card that the company gives you that explains that you have an implant. Again, this has been an incredible thing in my life. It's really helped me. And I'm very happy to share my story with anybody that asks me about it.
Thank you, Randy. Just the last thing I'd like to leave everybody with, that is my information to get a hold of me. You know, I've been in medicine for a while. This isn't, I got involved in medicine back in the mid 80s, and I've seen the evolution of care on many levels, you know, from any specialty, whether it's cardiac, neurosurgery, my field. And the way that I look at the implants and the future of what we do from a healthcare standpoint, I think CPAP is wonderful. And if you can tolerate it, great. But it's like driving from Phoenix to Las Vegas with a horse and buggy. Yes, it's completely reliable, but it's a lot of work. And the new technology that we have today, particularly with these types of implants, you're still going to drive from Phoenix to Las Vegas, but now you're going to take a car. And the outcome is the same. It's up to you what you would prefer from a treatment standpoint. Thank you, Randy, and thank you, Lauren, for inviting me to speak on your behalf.
Thank you both. I really appreciate it. 2 questions have come into the chat. The first one is for Randy. Randy, how long did it take you to feel better since you hadn't been sleeping for so long after you got your device? When did you notice a change?
That's a great question. You know, about 2 weeks into the therapy, I noticed I stopped wanting to take a nap when I got home from work. And then 5 weeks into the therapy, I had so much more energy. I actually lost weight, and there's no guarantee this is going to happen for anybody, but I had so much energy that I was doing my own yard work then, and my house was cleaner, and I was doing a lot more on my own. So 5 weeks, I was like, wow, this is incredible.
Awesome. And the second question is for Dr. Pearlstein. Does something actually go in my tongue is the question.
No, so there are two things that go within the body. One's going to be a small little cuff that wraps around a nerve in the neck through the one small incision. And the other one looks like a defibrillator that's a small incision that's put into the chest. There's nothing that goes into the tongue.
Thank you. Well, I want to thank you both. Those are all the questions that have come into the chat. If you would like to talk to Dr. Pearlstein more and see if you're a candidate for Inspire therapy, or if you want to talk to him about the other treatment options that are available for obstructive sleep apnea, you can call the number on the right and they will get you scheduled. And these are all of the locations that they are at. So you can find a convenient one near you. Thank you for coming. And if you have any more questions, you can send it into the chat and we will reach out to you. Put your phone number there or your email and we will reach out to you. We'll have Dr. Pearlstein's office reach out. All right. Thank you so
Thanks, Lauren.
much. Yep. Have a great night.